Hello viewers, so today we are back with another topic, another video, and today's topic is, do patients with stroke have any warning signs or symptoms in the days or weeks preceding to the actual stroke? So for that the answer is yes. There are several patients who have warning signs and symptoms in the preceding days or weeks prior to the actual stroke, and these are called as mini strokes or transient ischemic attacks. In short, they are called as TIAs. So by definition, TIAs are focal neurological symptoms which affect only a part of the body. They are sudden onset and they usually recover in few minutes or at the most few hours. However, by definition, they can last up to 24 hours. But in real practice, we see that they recover in 5 to 10 minutes or at the most within 60 minutes. So what is the significance of these mini strokes or TIAs? Because one can say that patient has completely recovered, then what is the fear? The fear is that out of these people who get TIAs, about 20% of them, they will go on to get actual major strokes in the next 30 days. And half of them, that is 10% of those who get TIAs, will have a stroke in the next 48 hours. So that is the real risk or the danger. And with proper evaluation and treatment, we can prevent almost 80 to 90% of those strokes from happening. So what can be done? So the number one is to do a good brain scan, that is MRI and MR angiogram, to look at any narrowing of the blood vessels inside the brain or any small clots, new or old. And then we need to look at the risk factors which has led to these TIAs. And the commonest is high blood pressure. Others are high blood sugar or diabetes, high cholesterol, and age is also a risk factor. So people above the age of 60, they have a higher risk, but it can happen in any age group also. And once we have looked at the risk factors, then the next step is to minimize this risk by proper interventions. And how can we reduce the risk of strokes in a person who has already got EIS? It is simple to remember as A, B, C, D, E. A stands for antiplatelet agents, which are blood thinners like aspirin and clopidogrel. As per the research studies, for the first 3 to 4 weeks, we need to use double antiplatelet, so both aspirin and clopidogrel, and after that they can be switched on to single antiplatelet. B is for blood pressure control, so keep the blood pressure below 130 by 80. C is the cholesterol lowering drugs like statins, so they should be given in people with high cholesterol as well as those who have normal cholesterol, because they can prevent future TIAs or strokes. D is the healthy diet, and E is for exercise. So 40 minutes of exercise, if it is done 30 to 40 minutes per day for about 5 days in a week, that can reduce the risk of TIAs or strokes. So what we discussed today is that, this focal symptoms like somebody who has slurring of speech, or suddenly they cannot see on one side, or one hand, one leg weakness, or one hand, one leg numbness, or imbalance of walking. If these symptoms come for 5, 10, or 15, 20 minutes, and then the person recovers completely, do not ignore them, because they are like warning symptoms or signs which can suggest that person may get a stroke in the near future. So proper evaluation and treatment can prevent most of them. So I hope you like this video and learned something from it. Please like, share this video, and subscribe to this channel for more similar videos in the future. Thank you.